Endocrine disease, Wikipedia audio. Endocrine diseases are disorders of the endocrine system. The branch of medicine associated with endocrine disorders is known as endocrinology. Broadly speaking, endocrine disorders may be subdivided into three groups. Endocrine disorders are often quite complex, involving a mixed picture of hyposecretion and hypersecretion because of the feedback mechanisms involved in the endocrine system. For example, most forms of hyperthyroidism are associated with an excess of thyroid hormone and a low level of thyroid-stimulating hormone. Types of disease. In endocrinology, medical emergencies include diabetic ketoacidosis, hyperosmolar hyperglycemic state, hypoglycemic coma, acute adrenocortical insufficiency, pheochromocytoma crisis, hypercalcemic crisis, thyroid storm, myxoedema coma, and pituitary apoplexy. Emergencies arising from decompensated pheochromocytomas or parathyroid adenomas are sometimes referred for emergency resection when aggressive medical therapies fail to control the patient's state. However, the surgical risks are significant, especially blood pressure lability and the possibility of cardiovascular collapse after resection. It remains debated when emergency surgery is appropriate as opposed to urgent or elective surgery after continued attempts to stabilize the patient, notably in view of newer and more efficient medications and protocols. Endocrine system diseases at the U.S. National Library of Medicine. Medical subject headings: Medline Plus Overview. Endocrine diseases. List of diseases. Glucose homeostasis disorders, thyroid disorders, calcium homeostasis disorders and metabolic bone disease, pituitary gland disorders, posterior pituitary, anterior pituitary, sex hormone disorders, tumors of the endocrine glands not mentioned elsewhere. Separate organs. Endocrine emergencies.